So the 4 sessions that we have going on here, the theme, the overarching theme of these sessions are how we provide an experience for our client. And that of course is going to be very different than the experience that we can provide our client when we have proximity. When we're remote, it becomes a very, very different kind of process. Good morning, Rhiannon. And what we want to look at is these 4 aspects of this process that we're going to, or the experience that we're providing them. The first is the intake. And I'm not going to go so much over the intake specifically, because as body workers, we're all familiar with how we connect with our client, how we ask them questions, the difference between having them open up and reflect about their experience rather than us leading them. We understand those things in reflective listening and all that. But really the important bits after that is, what tools are we going to utilize in an assessment process? How are we going to interact with their nervous system by giving them verbal cues, by helping them use a tool at their disposal or a specific body position, or perhaps even a strengthening exercise. And then the next bit is, what are we going to give them to take home? And so all these are going to fit together in how we're going to create this experience. And so then it comes back to what is in our toolbox, in our own experience, that we can share with our client. And if we think about assessment, isn't always just movement, though movement is going to be a big piece of what we're doing. Sometimes our assessment process is going to be based on getting a read for where our client is emotionally. What are their needs in coming to you so that you can help them? Hi, Yolanda, welcome. I like all your charts back there. It looks like Touch for Health charts. So the big piece today that I want to discuss is interacting with our client's nervous system. And there's a couple of different ways that we can do that. Now, some of us are very familiar with using manual muscle testing as one way of interacting with their nervous system. But here's the thing, that might not always be appropriate. That might not always be a skill set that's available. As practitioners working remotely, we would need to be able to have a skill set called remote testing. Now, as many of you know that I've written about, there's some initial problems that we have with manual muscle testing. And the problems are related to this binary relationship that we have with it, whether something is facilitated or inhibited, something is a yes or no, something is strong or weak. This is a binary perspective. The nervous system isn't binary. It is a spectrum. And within that spectrum, there are 2 modes of the peripheral nervous system. There's our sympathetic and our parasympathetic. And so if under normal circumstances, our nervous system should be in a parasympathetic state of rest and relaxation. This is where healing happens. This is where digestion happens. This is where recovery happens. When we're sympathetically driven, our nervous system is responding differently to our environment. And so each one of these sides has a spectrum. And so if we're using manual muscle testing, but we don't know what aspect the nervous system is in, our results are going to be skewed by that, and we won't know how it's skewed. And so this becomes a dilemma for us in using self-testing and actually learning how to self-test so that we can have this understanding of these two sides of the nervous system. Now I'm going to be having next week, next Friday, I'm going to do a 2-hour seminar on just this topic because it's more than I can present in this kind of format. And so that's why I want to get into test, challenge, retest. The essence of test, challenge, retest is this. Our nervous system is looking at the available building blocks in the way that we respond to our environment. So what that means is, say for example, I need to reach and pick up this cup. There are muscular coordinations that is going to allow that to happen optimally. If those movement coordinations aren't available, the nervous system is going to find a workaround. It's going to derive another option for achieving the goal, whatever that goal might be. Now, with test, challenge, retest, what we're looking at is providing the nervous system with another option that would be better suited for meeting the goal. So how would this work? So last week we started to look at neck mobility. And say someone has rotation to the left issue. So then what we know is the right SCM is part of the rotational complex. We also know that the posterior scalene is in a coupler with the SCM in creating cervical rotation. We also know that the levator scapula on the right side, if I'm turning left, this levator scapula has to lengthen as it's stabilizing the scapula so that we have rotation. Now, very common is a weak and upregulated levator scapula. And so that's going to create an inhibition response in the SCM pairing with the posterior scalene. That coupler is not going to be able to work optimally because that levator scapula is going to be working against it. So how do we provide the nervous system another option? We can temporarily remove that levator scapula from, I think the best word would be the view of the nervous system. Oh, I know how to deal with supporting my body here because I've got this tension here in my levator scapula. And so then we could look at temporarily inhibiting the levator scapula and then strengthening the rotation. This isn't any different than the ABA style of manual muscle testing where you have a function A that's responsive then you activate function B, and then function A becomes inhibited. And so what do? You temporarily remove function B from the equation so that you can give access to the nervous system to respond to that function A without function B playing or trying to get in the game, so to speak. And this is going to be our most effective method. And so then the next piece of this is identifying our client's needs, what their presentation is, using movement to assess their movement. What are we seeing in the way that they're organizing their body? How is what we're seeing correlating to what they're telling us about their experience? And then giving them a movement drill that's going to integrate the coordination pattern that we are seeing that they're not having access to. We're looking at restoring the ability for the nervous system to utilize a building block of movement that the nervous system wasn't able to utilize. That's the big thing that we're looking at doing. And so I think the best way to go from here is to just start playing with this process. Yeah. So who would like to be a volunteer and be the client? And we'll look at how this works. Yeah, Scott, I saw Scott's hand first. What you got going on, Scott? Can't hear you.
Neck's been pretty jacked up. Last week when we did the rotation stuff, I have really crappy translation. The label of arthritis has been given to me in my cervical spine. So left rotation is always more impeded than right rotation.
Okay.
So I mean, it's the exact example you just gave us.
Okay, so now one of the things that we can use from our manual muscle testing skills that has very good transfer is something that's called therapy localization. Is there anyone here that's not familiar with that term? Everyone's familiar with it. Fantastic. Okay, so the first thing is, Scott, have you had any accidents that would, I know a little bit about Scott's history. Have you had any accidents
I've hit the ground a lot.
That might be, related to why you're having these neck issues?
I've hit the ground a lot in my life. Snowboarding, skateboarding, surfing, cycling, running. I don't even know where to start.
Right. Okay. So, Scott, I'm going to have you stand up for us. Okay. Now, so I'm a dancer, and there's something that's called white space. And the white space gives us information about symmetry. Now, if you look at the white space of Scott's shoulder, I want to make sure that our video isn't backwards. So Scott, can you raise your right hand? Okay. So we're seeing the video in normal. It's not being flipped. Because if it was being flipped, then we'd be flipped, right? And so if we look at the white space between Scott's right shoulder and right ear, and we compare it to the white space between Scott's left shoulder and left ear, he's got less white space there, doesn't he?
Is this a good enough view for you, or do you want it higher?
That's good.
Yeah.
I can see. I mean, it's, some of the colors are putting an interesting thing. Now, Scott, oh, that's better, right? Like that. I like that. A little bit closer. Okay. Can you move just a little closer to the camera again, please? Yeah, that's really good. Okay, now I'm going to have you turn to so your back is to the camera. Now, from this view, we can see so much more with that left upper trapezius. You can see the density there. However, are our eyes lying to us? Meaning, is that left normal and the right is just depressed? We don't know that, but it's something to consider. It's something to consider. Okay, Scott, I'm going to have you stay facing away from us, please. Okay, so now I'm going to have you rotate your head to the right. Good. And now you're going to come back to neutral, and you're going to rotate the head to the left. Now, when you looked at that, did you notice when he rotated to the left that there was some suboccipital involvement when he rotated left? So again, rotate to the right. Suboccipital is staying long and neutral, and the range of motion is increased. And then rotate to the left again. Now, because I pointed it out, he changed, right? This is something that's very, very important. This is called performance gait. When we use our language to bring awareness to an area, our clients will change how they move. And the reason why they do this is because they want to be good, they want to be right, they want to, they want to perform. They're not in it to show us their primary coping strategy. Now, what we're going to do now is we're going to look at this from the front. So Scott, I'm going to have you rotate to the right. And so from this viewpoint, I'm going to say, oh, that's probably somewhere around 60 degrees, maybe 65. It's really hard to see it from the back.
A little more.
A little more.
I would say nose is here. So yeah, 7-ish.
Yeah. And then to the left.
This sucks.
And left sucks, yeah. And
Yeah.
so now,
45.
so where do you feel the tension in your body when you rotate to the left?
Right side neck.
You're feeling on the right side neck? Yep, okay. So now, what I'm gonna have you do is I'm gonna have you take your left hand and put it on the right side of your neck. And have your palm soft and broad.
So palm on or fingers on?
Palm. So you're wrapping.
Yep.
Okay. So this is called a self-TL. And now I'm going to have you rotate to the left. Did you see how the range of motion increased? Okay. This is what we know. There is something happening in that space. We don't know what it is yet, but we know that there's something happening in that space.
Could he also try to lift his right shoulder and then recheck his range of motion to the left side?
We could do that. Now, let's talk about what kind of information that would give us. Yeah.
Well, yeah, maybe the same information that when he brings his right trap into the
Okay. So
equation.
So let's look at this. So we have our benchmark, right? So Scott, turn to the left. Okay, there's our benchmark. Now turn back to neutral. Now shrug your shoulder up. Now turn to the left.
Same.
Decreased it. It made it worse.
Same. And I'm testing the whole time.
Right. Oh, you're self-testing? Cheater.
I'm working on it, man.
Hey, that's fine. That's fine. Okay, so now let's come back. I'm going to go over to the other side of my room for a second. So I'm going to go off screen. I'm going to grab a tool. Who's familiar with therapy canes?
Yeah.
A therapy cane is going to be one of those essential tools that we're going to want our clients to have. They're going to want to have a therapy cane. They're going to want to have a roller, massage balls. These are going to be the tools that we're going to be using when we're working with our clients. Now, this particular therapy cane is super unique. It's called the Body Back Buddy, or the Body Back Buddy. Yeah, Body Back Buddy. There are more possibilities than the standard TheraCane. These different knobs. One of the things that I like about this TheraCane is the double knobs back here. Because for the cervical spine, these are super effective. What we're going to do is we're going to find out which segment of the vertebra is creating the challenge for Scott. And we're going to get very specific. So we're going to take these two knobs, or what therapy cane do you have, Scott? Actually, before I do that, you've got that one.
Yeah,
You've got the standard one. Okay, so then I can't use this because that's not going to work. Because he doesn't have it there. Okay. So you're going to take this knob and you're going to find the place where C7 and T1 join. There's going to be a protuberance where the spine is more prominent.
I'm on it.
You're on it?
Yep.
Okay, now you're going to take the knob of the cane and you're going to put it just to the right of that protuberance, right at the junction.
Of 7 and 1. C7 and 2. Yeah, I'm on it. I'm on it.
Now you're gonna apply a little bit of pressure to the knob. Now see how my arms are neutral? You want to get your arms neutral. So now here's the difference. You're reaching around this way. I want you to reverse the cane so that you're, yeah. It becomes a very different thing. And then notice how when you do that, how your arms are neutral and you're able to get both pressure in, down, or up, or out, right? Mm-hmm. This way, we actually have less control. We can only go down and out. Okay, so now we're on the point. What I'm going to have you do is bring your chin down, lift your chin up. Bring your chin down, lift your chin up. So what am I doing? I'm working with flexion and extension. Good. Now remove the cane, rotate to the right, or left, I'm sorry.
Better.
That's better. Okay. So that's improved. Now, let's go back to that same point. And then you're going to tilt side, 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 side.
So crunchy.
Good. Now you're going to pull that away. And then you're going to rotate. It's even a little more better. So we're still seeing improvement. We had improvement in flexion extension. That looked like it improved even more. How did it feel to you?
Crunchy.
You felt more crunch.
Yeah, way more crunch.
Yeah.
My neck doesn't like that.
And so here's the thing. Visually, we saw more range of motion. Scott's experience was that it was more crunchy. Could that be because he's moving his structure and range of motion that he hasn't been used to moving, and there's an accumulation of joint salts in the joint capsule? That would be what I would be thinking about. When we increase range of motion, but discomfort goes up, or that sensation of crunchiness, it's because the body's able to move further into range of motion. Okay, so we did flexion, extension, lateral flexion. We're going to get back on the point again, and then we're going to go to rotation. So we'll rotate right, rotate left.
Good and crunchy.
Good and crunchy. Yeah, your range of motion is increasing. And we also know that there is arthritis in the joint, because Scott had told us about that. We didn't go into taking a look at x-rays, and what kinds of history he's had with either chiropractic or getting x-rays. That would be something that we would go into. I know a little bit about Scott's history, and so this is something that I haven't done with Scott before, is this kind of process. Now, we're going to go up one vertebra.
I just did.
So you're already ahead of us. So you're at C6, C7 junction?
Correct.
Okay, so we're going to do the same thing. We've got flexion, extension. Now, here's the interesting thing. We don't necessarily have to separate it out working with our clients between going flexion, extension, lateral flexion, and rotation. We can have them do it all as kind of a shotgun. But if we want to get more and more specific, we can start to break it down. Wow, look at that.
It's even better. That's C6, C7.
That's even better.
That's where most of the arthritis is.
Yeah. Okay. So now let's go up to C5, C6.
Okay.
Okay. And flex. Oh, he's getting a little more extension now too. And then lateral flex. His lateral flexion's improved here more than on 6, 7. And then rotation. Rotation holding the point.
Oh,
Sorry, Scott.
that's okay. That's better to the right.
Oh,
Pretty crunchy to the left.
yeah. Range of motion's really improved.
Way. Yep.
Okay, now go ahead and remove the tool.
I mean, it's stiff and discomforting, but it's still, the range of motion has increased quite a bit.
Yeah, it has increased. Okay.
And even more
Now
so
what
to
I'm
the
gonna have
right.
you, now what I'm going to have you do is, this is going to be a tone down technique. We want to tone down the muscles. So Scott, you're going to lightly brush down, and it's just super light, like that 5 grams of light pressure, like in cranial.
Mm-hmm.
We just want to talk to the receptors in the skin. Good. And now let's look at rotation again.
Even better.
It's improving more.
I
And
feel
what's-
more tension,
what
more into
tension-
here now. Lateral.
It's more lateral now. It's shifted.
Yeah.
And brush it there. And so what this is doing, we're not fixing anything in the nervous system. What we're doing is we're toning down how the nervous system is responding to the stimulus of movement, so the nervous system can start to find a better option. You got something going on in your hyoid, huh?
Yeah.
Yeah. Okay, so Now what we're going to do is you're going to go just to the medial edge of your SCM, and you're going to drop down lateral to your hyoid, and then use your fingers to hook slightly in. Good. Now release that. Now rotate to the left.
But feels better.
It feels a little better. Yeah.
Yeah.
Okay, so now you're going to go back onto that, and you're going to start to move your fingers up and down and lateral to move the SCM to the side so that you can drop down towards the longus colli.
Oh, sure.
Yeah, so you're going to make that space in there? Okay,
Yep.
good. Yeah. Now, what I want you to do is take a long, slow breath in, full breath, and then you're going to hum. You want to feel that in your fingers, that humming. And then when you're done with that breath, that exhalation, make a little bit more space. See if you can go a little deeper. Maybe move down in a vertebrae or up a vertebra.
Well,
See if there's a
crank you
place
up.
that gets your attention. And then take a long breath in and hum again. So what this humming is doing is the vibration is acting on those receptors.
I could feel it vibrating in my fingers and on my wrist.
Yeah, good. Okay, now go ahead and remove that. Good.
Less discomfort.
Wow, that's fabulous.
Way less.
Fabulous.
And it
Okay,
feels
so now
bug to the right.
what we've done is we've given Scott two different ways of working with his neck that he can utilize as homework now. The first is taking the therapy tool and going segment by segment with flexion extension, lateral flexion, and rotation to start to work on the spaces in the joint capsule and the musculature around that. This is kind of like pin and stretch. And then the second thing is, actually there were three. The second thing is that we can use a light stroking of the skin in the direction of the muscle fibers as a way of toning down the musculature. And the third thing that we did was how we can get into the anterior throat, the hyoid area, the longus colli, and use our breath and vibration of humming as a very gentle way of releasing those structures. Everything that we have, that we ask our client to do, we want it to be non-threatening, non-invasive. We don't want to do anything that's going to stimulate their symptoms. We want to just always be thinking about toning down, toning down, toning down. Good, Scott. Now,
Much better.
it's
Need
going-
more. I mean, I'll need more work in the neck because I don't give myself enough self-care
Yeah.
anyway.
You're going to need more neck in the work in the neck, and the other thing that I would want to look at the next session would be the relationship to your shoulders to your lumbar.
Okay.
Right? Because what's driving the neck might be coming from the lumbar.
Oh, no doubt. To be continued.
Yes, yes. That was excellent, Scott. Thank you.
Thank you.
My question for you all is, what did you notice in your own response observing that process? Was it familiar? Was it unfamiliar? Was it surprising? Was it unsurprising? How did that land for you? Someone be brave.
Well, for me, it was a little bit. Certain things were familiar, but like the humming and stuff, like to tone down the nervous system, that was quite new for me. So really interesting.
So you
Thank
got a
you.
new tool.
Yeah.
Yeah.
So I'd like to add to that, is I've been working with a sound therapist, I believe I told with Joseph online, and that's all she does. She will have me, let me just get this chart really quick. She'll have me extend my arm because I have nervous symptoms on the arm as well. And she'll have me say like things like Lucy and have me feel the vibration throughout the point where the blockage is. That was very, very interesting for her approach. And it's an open sort of like just practitioners getting together with other practitioners around the globe and seeing how people work. And that sound vibration thing kind of floored me. And it's very interesting you brought that up, and you can really feel that vibration. And one thing that she talked about is like when you're doing, you have both fingertips on either side of your cervical spine. And whatever you hum, you should feel it on both sides. If you're not feeling it on one side, more so on the other side, then you have a blockage on one of those sides. And she works mostly with professional singers and actors. So I was introduced to it about 3 weeks ago, and it floored me. It floored me.
Yeah.
Mm.
Yeah. And
It was
so
powerful.
this is related to how frequency moves through our body. If you think about our body as a collection of water bags, right? That's essentially what fascia is doing, is it's creating a boundary for each of these unique compartments so that they can work in discernment from one another. Our fascia compartments should have the ability to glide and move and activate interdependently. When they can't, that's caused by a couple of different things. It could be caused by the nervous system doesn't have access to the functions of those compartments. Or, oops, I was seeing notes in the chat, and I can't read it without my glasses on.
Want me to read it to you?
No, that's okay for right now. I want to finish this thought. It's either the nervous system isn't able to have access to those compartments, and so part of the safety strategy of the nervous system is to thicken those connective tissue structures as a way of bracing, right? And so we see this all the time in like people that have low back pain. What happens with low back pain? The nervous system restricts movement, and the connective tissue of the lumbar dorsal fascia thickens as a way of bracing and protecting. When this occurs, then the vibration can't move through those structures. And so that's a really cool tool to assess whether or not vibration and frequency can move through the structure. And if it can't, then we need to find out why and do whatever manual intervention. It might be a physiological intervention. It might be a limbic associative intervention. Now, let's look at how we can incorporate those kinds of interventions with our clients. So the structural intervention that we saw, we have the light skin stroking, we have vibration work, we have using a tool to act as pin and stretch. But what about if it's something that is a physiological function? How can we work with that? Now, If it's a circulatory system like the lymphatic system, we can guide our client into opening up lymphatic ducts and moving lymph. But what if it's organ related? There's a general technique that we can do. And this technique is, it's not a fix-all, but it's a fantastic tone down. It's called neural unwinding. Now I'm going to move my camera view so that you all can see this, and I'm gonna move to the floor. So we'd have our client, can everybody see my legs and hands and feet? Can you see my feet?
Yes.
Okay. Neural unwinding, we're gonna cross our legs. We're gonna take our hands and interlace our hands and bring our hands up and through. Then our tongue is going to go to the roof of our mouth. Our teeth are going to be separated, but our lips are together. And then we're going to practice nasal breathing. Now, the interesting thing is, with this, is there are 4 different possibilities. Because we have legs can be crossed one way, arms can be crossed one way. There is the right way to do it for that person's nervous system where they're at in that moment, and it can change. And this is related to the subtle body meridian field, how meridians and organs relate. In order to get the cross right, this is where we need to have a Cook's hookup. Excellent. Thank you. This is where we can use our self-test manual muscle testing. Now, we want to learn a couple of different ways that we can do this. In classical applied kinesiology, they use anterior deltoid as an indicator. Now, instead of going into looking at receptor response, we're going to use what's known as limbic resonance and the power of our intention, the power of our mind. We're going to ask the body, show me yes, show me no. Show me yes, show me no. Let's everybody try this. Good. Now, when we're self-testing, we want to think about, we're not looking at how strong muscles are. We're looking at how the nervous system is responding to our thought. And so it's very light. And it's also incremental, meaning, how many of us are familiar with a rheostat on a light switch? Yeah? So if we're in a dark room and we flick the bright light on, our nervous system goes into shock. But if we turn the lights on slowly, our nervous system can adjust and adapt to that stimulus. The same is true with our muscle testing. This is one way. There's another way that I like. If we think about the friction between our fingers, so we have our finger pads here, and it's not like snapping your fingers, but there's like that 5 grams of friction, and it's a very gentle. And so right here, I'm just feeling the friction. And then it becomes what is yes, what is no? What is yes, what is no? And this takes a minute to feel. But once you feel this, it's very reproducible and it's very accurate. And what I like about it is we can be very discreet with it. Meaning we don't have to be letting our client know that we're testing them. This can be very, very important. Okay. Who would like to be a demo for me? Okay, great. Great, Yolanda. Do you have a place that you can lay down there that we can see you? Maybe? I'm sorry, I can't hear you.
I have to move my table, but yeah, I can, I think. I don't know. Maybe Nick should go. Maybe he has a better spot.
Okay.
Nick, do you have a better spot?
Sorry, what do I have to do?
Well, we just need a place where you can lay down where the camera, you can be seen from the camera.
I got a spot if it's taking too long.
He's got it.
Okay.
You need to point your camera down a little bit, please.
Yeah.
Perfect. Okay, great. Okay, so I'm going to qualify my indicator. Let's have everybody qualify their indicator. Let's see who's getting the same responses. Okay, Nick, I'm going to have you cross one leg over the other. So you're crossing your ankles. What'd y'all get? Oh, you're doing it a different way. Yeah. Okay, let's have you cross the other way.
I got a yes.
Yeah, okay, so the first cross was a no for me and the second cross was a yes. Okay, so now I know that's the correct cross for the legs. Now getting the correct cross for the arms to match is a little bit tricky. The instruction here is I'm going to have you reach your arms out, turn your palms together, or the back of your hand, the back of your palms, so your palms are apart, and then cross your arms and interlace your fingers. And then wind your fingers back up to, yeah. Okay. I got a yes there. Now,
Yeah, me too.
maintain your cross, and outstretch your arms. Outstretch, maintain your cross. Now switch your cross. Now this becomes very important that we have them outstretch their arms to switch their cross, because we will get lost and they will get lost on what way they crossed. Now pull your arms back under. Nope.
I gotta know.
Yeah, no.
Gotta know. Good. Okay, so now keep your hands clasped, outstretch your arms again, and then switch your cross again. Beautiful. And then thread. Nice. So that's the right cross now for Nick. This could change in an hour. This could change tomorrow. The next piece for this is, Nick, go ahead and bring your neck to neutral so that you're not looking at the camera. And soften your jaw, teeth slightly apart, lips together, tongue to the roof of your mouth. And now practice your nasal breathing. Now for this nasal breathing, let's use square breathing. So if you're able to count to 3 on your inhalation phase, during the pause at the top, you're going to count for 3. And then you're going to exhale for a count of 3. And then at the pause at the bottom, you'll count for 3. And you'll continue with that cycle of breathing evenly. Excellent. And then you're going to slowly unwind your arms. And then you'll uncross your legs. And then you'll roll to one side. You'll use your arms to assist you coming up to standing and re-engaging gravity. And then coming back to your chair. There was another piece in that, in how we coach our clients to exit from a posture position. We want to encourage them to not only take the path of least resistance, but also not to effort in such a way that they're going to undo with that experience they just had. Now, I have yet to come across someone where—
Rhonda had a question, I think.
Okay, great. Let me finish this thought. I have yet to come across someone that doing this doesn't tone down their system and relax them. It's very, very potent. This is something that when I first learned it, oh my gosh, it had to have been 25 years ago at least. I would do it daily as part of my winding down ritual before retiring for bed, as a way of resetting my nervous system so I would sleep optimally. And I have found now that I will go to that or hand mobility. Doing hand mobility is another way of accessing our nervous system, because the hand dexterity and the amount of area that the homunculus has in our cortex for hand is phenomenal. Like if you wake up with this insomnia and you go through all your hand mobility work, you can fall back asleep. It's kind of a trip. Nick, you had something you wanted to say, and then Rhonda had something.
Oh, I just said Rhonda had a question, so I don't have
Okay.
anything to say.
Rhonda, please.
I was curious to know how long you instruct the client to do the breathing while they're crossed. How do you know when they should stop?
Well, yes, that's a great question. When we're in person, we can have a sense when they take that parasympathetic breath. Perhaps we wait, yeah, exactly. Perhaps we might not be able to pick on that cue when we're remote. What we can do is give the client the instruction, when you feel this is complete, go ahead and unwind from the winding position. And then it puts the ball in their court too. Self-empowerment, right? It's their experience. We're guiding them with this experience.
Okay.
Great.
Fair enough.
Great question.
Joseph,
Yeah.
what I'm experiencing that when I place the tongue on the roof of my mouth, for me, that's a better self-test way. Is there any difference in it, or?
Sure. No, that's completely, that's quite valid.
Okay.
There's seemingly an infinite amount of ways that we can self-test. Another way that I like to do, I'm going to move my camera so that you can see this. What is yes? What is no? What is yes? What is no? And so I'm actually using a hard surface, and the yes and no becomes my fingertips. That's another way of self-testing. And so there really is just so many different ways. Like, for example, chiropractors will use leg length. Virtually anything can be a self-test. It's what's comfortable and repeatable for you. That's the most important thing. And comfort is super key, because this repeatable and sustainable should require very little energy. Because if it requires energy, then the resources for that energy might not be infinite. You might run up against that wall where all of a sudden your nervous system doesn't have the capacity to maintain that testing, because self-testing is a stress. It is a stress on our nervous system. It does take resources. What was that, Scott?
I was responding to Yolanda's chat. She had said a yawn would be a good clue or a good cue that it's been long enough, and I just typed in any parasympathetic response will be a good cue as well.
Yeah. Now, interestingly, I know many practitioners that when they are working with their client, their body, the practitioner's body lets them know that they had a parasympathetic response by their own yawning. And so there's so many different ways to look at this. And we're all going to be unique in finding the flavor that works for us. But we want to come back to, it's not about our ability to test our client's nervous system. It's about our ability to provide an experience for our client that they want to engage in. So one, we're helping them with having a more optimal experience. And two, they're going to be progressing in their own path. Because when they're progressing in their own path, then they will recognize that you're a guide that's helping them. And they're going to want to come back for more work from you. And so this isn't like necessarily a one and done. Now we have a few more minutes, and I'd actually like to hear from you all about your experience with just what we shared today, and any questions you may have around that, or how you would implement it with the tools and experiences that you have at your disposal.
I'd like to say something really quick, because I got to bounce. All week, I was struggling with the indicator, the self-indicator test. And I was, like Joseph pointed me out, to reach for a book. First shelf, second shelf, third shelf. Find that book. Reach in the refrigerator. Every time I reached for a beer, it went no. So I knew it was getting closer and closer. I reached for milk, or like even when we were first doing it, like, this is just lemon water. Tastes great. This is alcohol. Always goes no, just to clean my glasses. So just play with it until you feel comfortable with every single test. Your tongue, and then you may switch. One test won't work, but you always have two that you can sort of bounce back, whether it's a sway test or your friction test or this test. Just constantly play with it. And it's taken me solid 2 weeks to being like, I'll never get this, until I swear to you, reaching in the fridge was the best thing. When I really wanted that beer, I drank that beer, but I probably should have drank that beer. But I gotta go. Thank you for everything, guys.
Thanks, Scott.
I'll talk to you next time.
Okay.
So with the crossing over of the leg, we could use the fingers to do self-test. But with the crossing over of hands, what kind of self-test we can use?
I'm sorry, can you say that again? I didn't quite
No,
understand.
with the crossing of the hands, I mean legs, we could use fingers for self-test. With
Yeah.
what we did, yeah, with that, how to do self-test? Which hand should cross over which way?
Well, we want to let our client initiate from their experience first. We don't give them the specific instruction on what leg crosses over or what arm to
No,
cross.
what if we are doing for ourselves, like for self?
What is it doing for them?
No, when we do for ourselves, how to know which arm to cross over?
Oh, well, this is when we won't have a hand to muscle test ourselves with.
Yeah.
Right? Now, here's an interesting thing. Our mind is so potent that we can ask ourselves what is yes, what is no in our mind, and and we will go to the yes or no. We can also use our structure as biofeedback. Now, Nick was talking about using the tongue. So the way that we can use our tongue is if you bring the tip of your tongue to the front of your incisors, and then you say, what is yes? Your tongue will move to one incisor or the other. And then what is no? And your tongue will move to the other one. And you can start to get it that way.
Okay.
But it really becomes a practice of being clear with your own biofeedback. And it is definitely something that's practiced and learned. Rhiannon had something to say about that, and I can't quite read what she's saying.
I can read.
Oh, yes, go ahead.
Hi, Rhiannon.
I was going to read it for you. If you are most comfortable with test using your hands, you can also cross one way, come out of the cross, and then test. Just remember which way you had your arms crossed to go back. So it's just reiterating what Joseph is saying, is that you can hold on to that memory. There's also a technique of calling locking it in place. I'll use this through my hips, or but that is, it's called stacking, but that's a totally, it's a kind of advanced type of technique. And so literally you hold the memory of what position you're holding long enough to be able to kind of test right after. It works. A lot of it is intention.
Probably all of it's intention.
It is, yeah. It is.
Yeah, I'm familiar with that stacking technique also.
Yeah.
So here's the thing. I think that if this is a new skill set for us, we need to simplify this so that we're not learning something so far out of our norm, out of our comfort zone, that it's going to take us, so much practice to get to where we're comfortable with it. We want to be able to be comfortable with it right away. This is why I started with the test, challenge, retest, is because that is accessible to everyone at this point without having any manual muscle testing. And we just have to start where we are and know where our comfort zone is. And if there are places that we need to acquire new skills, then we can go seek out those skills. But if it's not within our time frame of need to respond to our clients reaching out to us, asking for help, then we've got to utilize what tools we have accessible now.
So I had a question. My background is Touch for Health and sort of specialized kinesiology. So I do not have body work, anatomy, physiology. Like a lot of that is not within my like understanding. So when you are working the points on the, oops, sorry, of course it's got to go. It happens that way when you're unmuted. Okay, so we're working on the levator scapula for Scott. Is that, we're opening up the vertebrae points. So would that be very similar to like an insertion origin technique, or that is totally, or even like a vertebrae reflex type of technique? Or are we dealing with what we would call reactor muscle?
That's a really good question. So reactive muscles is actually a fairly old kind of process related to, can the muscles work in coordination with each other? Now, we also know that muscles are at the very bottom of the food chain as far as the nervous system. Muscles act on connective tissue. Those connective tissues act on joints and ligaments. So the joint capsules and the ligaments have higher priority afferent inputs into the nervous system than the, excuse me, than the muscle spindles. So when we're doing the pin and stretch work, unless we have the skill set to be able to specifically stem a receptor type, we're not going to be able to identify what specifically we're working on. But that's okay. We don't necessarily have to do that. Now, looking at from the perspective of Touch for Health, you can have your client go through a motion. You can then be the indicator. And then you can have them TL the neurovascular, the neurolymphatic points. And then once you find the right correlation, then you can have them do the stimulus on the neurovascular, the neurolymphatic points. And so you can easily adapt your skill set to working with your clients based on Touch for Health.
Yeah, so with this here, because I don't have a cane, is this, because you're opening up sort of, is that kind of what you're doing, is sort of opening up that vertebrae sort of connection there with that type of technique? And then the other question I have is, were we using those specific vertebrae because we're working with the levator scapula, whereas if we were looking at, say, a lower body muscle, like the, you know, we're having rotation in the pelvis, would we be using a different segment than of the vertebrae with that same type of pin and stretch technique?
Yeah, great question. So from my viewpoint, what we're doing with the pin and stretch is we're stimulating the receptors in the joint capsule. And so when those receptors become stimulated and more range of motion is increased, circulation is improved, then the nervous system sees that as an opportunity. There's something available there for the nervous system to utilize, to respond with. And so we weren't working on the levator scapula. The levator scapula attaches up in here in the cervical spine, up at C1, 2, and 3. We're at the base of the spine, so we're looking at how the base of the cervical spine will couple with the upper thoracics. And if one or the other isn't able to move, it's going to inhibit the whole lot. Great question, thank you.
So technically, I would be able to sort of go through the spine, find where that hinge is, like where that, where it's not, you know, doing it, and have them do pinning the rotations and stuff like that while holding that particular spot. So
yes, And
Okay.
because of your skill set, you can use your own body to just be a surrogate and scan your client's
Yeah.
body, right?
Yeah.
That's beyond what
Yeah.
I could share with most people.
Yeah. Okay. No, that makes sense. I was just trying to figure out where the technique that you're teaching kind of fit in between. And I think it's very similar to a type of technique that we would call vertebrae reflex.
Yes.
Yes. Yeah. It's just a different type of stimulation. So thank you. That was
You're a
very, yeah.
chiropractor?
No, I'm not. Like,
Okay.
I've taken Touch for Health, and so yeah, and then a few of the other courses, and so yeah, that's how I work on people. And I became very fluent at muscle testing because it was the only way to work on myself.
Exactly.
Yeah.
It's a great language of biofeedback.
Yeah.
It is. That is. Thank you. Anyone else?
Joseph, the initial symptoms for Scott were felt in the posterior neck, and then symptoms shifted to the anterior neck. If you were to have felt it, someplace else after, would we have kind of gone down to another body location?
Yes. Yes. We would follow. I like to call it following the breadcrumbs. Yes, we would just follow the pattern, because the nervous system is, well, it depends. Because the nervous system is going to either lead us to the prime driver, or it's going to be in a place where avoidance, it's not safe, and it's going to lead us away from, because it's just not safe for that person in that place. And that's actually something that we have to recognize, is that sometimes people have these set of symptoms that they're experiencing, but they don't have the inner resources to unpack them, especially if it's related to an event, an association, an emotion that is unconscious. They don't have access to it, and it's not safe. And the nervous system is not going to let us open Pandora's box, so to speak. And so this actually brings to that point of we can't fix it all, and we have to recognize it's not our responsibility to. What our responsibility becomes is being a helper and a guide for the people that come to us, because they're going to come to their own healing process in their own appropriate time when they're ready.
Great. Thank you so much.
Good question, Matt. Thank you. I see Misty leaning in with a smile. Well, you guys have been a great group today. We're going to continue with this exploring the experience. Now, I like the idea of the demo work, because we have to get an idea of how we can work with people, and we've got to start somewhere. And there's just so many different possibilities, whether someone's coming with a lumbar issue, whether someone's coming with you with a hip issue or a foot issue. And this is why I've created optimizing assessment, because in optimizing assessment, we have a progression of movements that we can utilize as ways of giving our clients homework so that they can reinforce whatever we've brought them through in their process. Now, next Friday, I'm going to be doing a course. It's going to be a 2-hour course at this same time, like 10 to noon. And I want to go over nervous system response, so we can start looking at the 4 modes of nervous system responses and how we can sophisticate from this binary yes, no into a more overall approach of looking at, is the nervous system in the parasympathetic state? Is it in a sympathetic state? And this comes down to how our receptors are responding, because receptor response changes between sympathetic state and parasympathetic state. And so that becomes a benchmark to know whether or not the stimulus that we're providing our client is a stimulus that's creating a sympathetic response. And this is going to be super potent, because then it's going to make everything that we do that much more powerful, because we know, oh, this intervention is creating a sympathetic response. One, that's either not appropriate, or two, there's a reason why it's creating this sympathetic response, and we need to find out why. Because under a low load condition, we should have capacity to respond over a spectrum of stimuluses. Wow, you guys. Anything else?
How do you sign up for the Friday, next week Friday?
We're going to be sending out a newsletter either today or tomorrow, I think. We haven't posted it yet.
Is it the same information that we got in the original DNA course?
Yes, though, as with all things, information refines.
Mhm.
Awesome, you guys. Now, Carrie, is it okay if I speak a little bit to your post that you put in the discussion forum? Yeah? Okay. So in the discussion forum, if you guys go into the discussion forum, you'll see that Carrie made a post about her experience with the neck mobility that we did last week. This tool that with the Body Back Buddy, with the double knobs, is super, super potent, because we can put that right up into our subocciput. And then we can go into an atlas axis movement of flexion, extension, rotation. Now we know the atlas and axis does not do lateral flexion. And you can start to get into that, and you can start to feel where the painful tight segments are. And then you can use the same thing of okay, we've got this benchmark of this is tender, and I feel it on the left side. Now I'm going to go down a vertebra, and I'm going to hook into that left side, and I'm going to go into lateral flexion, rotation, flexion, extension. And I'm going to go back up to the occiput, and I'm going to recheck. Oh, it got better. Or it got worse, or it did nothing. And then you can start to use the breaking it down component by component. That's why I started with Scott. Just do flexion extension. Let's see how that changed it. Mm-hmm. Let's do lateral flexion. Let's see how that changed it. Breaking down the individual components.
Okay, I'll probably do that.
You'll probably do that. Do you have a therapy cane?
No, but I can be creative.
You know, then you can take your thumbs.
Yeah.
And you can use your thumbs. Now, here's the thing about when we're using thumbs. We want to think about not pushing with our thumb, but using the motion of our elbows to drive leverage through the long bones of our arms, into our thumb, rather than trying to, this is why people get thumb injuries in body work. Mm-hmm. Is because they're muscularly activating their thumbs instead of using the lever of their structure.
Yeah.
That's a very different thing than this.
Oh, yeah. I know I've had a thumb injury.
Yeah, yeah.
Yeah.
It's actually fairly common.
Mhm,
You know, I injured my thumbs when I was about to go.
mhm.
You know, it's like, oh man, you got to get in there and release it for people. No, actually, you don't. You know, we actually have learned over the years that 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 muscles are just simply following the instructions of the nervous system. And so if we change how the nervous system is responding, the muscles respond with it. This is why Touch for Health is so potent. Are you saying bye, or are you saying you want to say something?
Say something.
Great, Rhonda.
So Scott left, so we weren't able to recheck his shoulder height before he left
didn't change-
after all that work.
Yeah, it didn't change his shoulder height.
Oh, okay.
Yeah.
Only his ability to move his neck.
And then we actually got some more information about how he was having pain down his arm.
Oh, right.
That low shoulder. So what that does is that tells me that there's a possibility that he's got some TOS happening. And I'd want to look at that relationship of scapular stability to how the pectoralis minor is functioning, the scapular rib cage, and looking at this ability to have this rotary plane of scapular movement.
I'm sorry, do that again?
That's where I would go next with Scott. So that's a really good question. And sometimes doing too much with a client becomes an adverse situation. Sometimes it's like we just do little pieces at a time to see how they respond. It's like, I don't know if you remember the old school trigger point therapy work, where people would just go in and shotgun people with all this deep work, and then they'd be just in a state because their nervous system was overwhelmed by all that stimulus. And so this comes into that philosophy of less is more. You do a little bit, and if it's the right input, there's going to be big changes. But if it's not the right input, hopefully it's doing no harm, so you can find the next piece.
Joseph, I really have to go because I have to make some dinner.
Yeah,
Otherwise, I get into a fight with my girlfriend. So.
No fighting with the girlfriend. Thank you, Nick.
But thank you.
We'll see you later.
Bye.
Well, I know I've kept everybody 25 after, and I appreciate you all. And thanks for coming in and giving me this opportunity to share with you. And I hope you'll practice this process of taking people through movement, using a tool to help release their structure. Has their movement improved? Giving them homework. Yay. If there's not anything else anybody'd like to share, I'm going to say goodbye now.
All right. Thank you.
Thank you, John.
Joseph, if the client gets worse,
If the client,
Joseph, if the client gets worse, what do you do?
you need to reevaluate what you've done, and you're either removing a necessary coping strategy, or you're stemming the prime driver.
Okay.
Right? Because if we think about the relationship between the prime driver and the main pair, if we stem the main pair, the prime driver gets better. But what if the prime driver is the symptomatic piece? And so then we're treating the symptom, and we're making it worse. We're revving it up. And so we have to evaluate that. Right? And so with Scott, and the rotation, his rotation would get worse. And we know that's the wrong stem for his system. And so hopefully we're going to catch this with our movement and the benchmark of movement if the benchmark changes unfavorably. Now, the other piece of that is sometimes our clients become overzealous. They think more is better. And so then we have to check in with how much release work they're doing versus the strengthening work, what we're trying to get back into the game. Their objective might be opposite than what's optimal. That was a great question. Well, you guys are awesome. Have a fabulous week. And hopefully by the end of the week, we'll have a newsletter out to you guys. Oh, and then I'm thinking Friday at 10, I'm going to do a 2-hour gait movement shop because I need to beta test how I want to film my gait seminar. And so I'm going to like offer like a free course. And so I'll post that on my wall. Or I'm going to make an assumption that everybody's my friend on Facebook. I don't know if that's true or not, but I'll post about that on Facebook and some of the other forums and also DNA, and I'll announce it. And it's going to be a live seminar, and I'm not going to record it, so it won't be something that's available as a recording afterwards. It's just I want to beta test my own process so that I can get some feedback on how it worked for people.
And that's from 10 to 12?
Yes. And I'm going to be creating a Zoom link for that. I'll post that Zoom link in the discussion section of this as well. Did everybody see that there's a discussion session and there's already been 2 discussions? Great. Yeah, I think that's a really fun feature. Okay, y'all, have a fantastic Wednesday, and we will see you all soon.